Hello, everyone. It's Dr. Annalyn Schooley, president of the Florida Family Therapy Alliance. It is my delight to this evening to have Ashleigh Irving and two of her staff from the Division of Medical Quality Assurance, and who work specifically on the board of what we affectionately call the 491 board, social work, marriage and family, and mental health counseling. And Ms. Irving and two of her staff are here this evening to tell us, just general information to get us all up to date, and to answer questions this evening. So I am just thrilled to have you here, Ashleigh. What should MFTs and the other people who watch this video, what minimally should they know about you and about the board?
Well, good evening. My name is Ashleigh Irving. I'm currently serving as the Executive Director for the Florida Board of Clinical Social Work, Marriage and Family Therapy, and Mental Health Counseling. I also serve as the Executive Director for the boards of Podiatric Medicine, Opticianry, Orthotics and Prosthetics, Hearing Aid Specialist, Genetic Counseling, and Athletic Training. With me today, I have two of my staff members, Madeline Wands, the regulatory supervisor for our office, as well as Candace Knighton Black, who serves as the regulatory specialist 2 and team lead. Candace is our frontline worker for the marriage and family therapy professions. And so you probably have seen her name quite a bit, and we probably communicate with her quite often, as well as Candace serves as the person that issues the exam approvals for the marriage and family therapy profession. So I'm grateful to have both of them here with us tonight, and we are going to dive into some introductions and information about the board in just a minute. So
Fantastic.
I prepared a presentation. Can you see it okay?
Yes.
All right. So give me just 1 second to get set up. I may have to turn my camera off just to accommodate the way my computer is set up.
So far, so good.
All right, perfect. So we are from the Florida Department of Health Division of Medical Quality Assurance, which works in conjunction with 22 healthcare boards and 4 councils to license and regulate 7 types of healthcare facilities and over 200 licensure types for 40 different professions. We are broken down into 3 bureaus, which consist of the Bureau of Healthcare Practitioner Regulation, where our key process is licensure. We're also there's a second leg of the bureaus, which is enforcement, and their key process is enforcement. And the last leg of the bureaus is the Bureau of Operation, which their key process is information. They help to support the work that we do all around the division. Our mission is to protect, promote, and improve the health of all people in Florida through integrated state, county, and community efforts. Our vision is to be the healthiest state in the nation, and our values are I care, which represent innovation, collaboration, accountability, responsiveness, and excellence. As Annalyn has told you, we all work in partnership with the Florida Board of Clinical Social Work, Marriage and Family Therapy, and Mental Health Counseling. That's probably going to be the last time you hear me say that very long name tonight, as we are affectionately known as the 491 Board. We are referred to as the 491 Board as we fall under Chapter 491 of the Florida statutes. That is the chapter that regulates the professions of clinical social work, marriage and family therapy, and mental health counseling. The board's primary responsibility is to protect the health, safety, and the welfare of the public by ensuring that healthcare professionals that they license meet the statutorily mandated standards of competency. So essentially, the board is the governing body for your profession, and they enforce the laws regarding the profession. They even get to write some of those laws. They help to regulate, the scope for the profession as it is defined in the Practice Act. And sometimes they even have to take disciplinary action against a license in response to violations of that Practice Act. I'm gonna just move forward a little bit. I want to talk about the composition of the board in general. So the Florida Board of Clinical Social Work, Marriage and Family Therapy, and Mental Health Counseling, or the 491 Board, is comprised of 9 volunteer members who have been appointed by the governor of Florida and confirmed by the Senate. The board is made up of 2 members who are licensed clinical social workers, 2 members who are licensed marriage and family therapists, 2 members who are licensed mental health counselors, and 3 members who are consumer members and have never been connected to any of the 3 professions. This is our current makeup of the board. Of the 9 positions, we have 3 seats filled at this time. The licensed marriage and family therapist on the board is Dr. Claudia Vincencio, who also serves as our chair. She is duly licensed as a licensed clinical social worker as well. We also have Ms. Tanya Kraus, who is a licensed clinical social worker, and she sits in the LCSW seat. And our consumer member is Dr. Joaquin Molina.
Now, at the present time, since you only have 3 of 9, can the board do any work since they don't even have a quorum?
Well, they do have quorum. So as of right now, the quorum is based on how many sitting members we have. So right now we have 3 sitting members, and quorum will be 51% of those members. So as long as we have at least 2 members present, we can conduct board business.
Good to know.
So here's a list of the staff members. I know people think about state government and think there's a ton of people working here. So I want to just give you a breakdown of our office. There's myself, Ashleigh Irving, the executive director, as well as 1 program operations administrator, Karen Copignon. And I know you've seen Karen here in the past. Unfortunately, tomorrow will be her last day with our office, and we will miss her dearly. Following Karen is Madeline Wands, who is the regulatory supervisor and consultant for the board. We have 1 government analyst too, who has been designated to process CE provider applications, as well as the new counseling compact applications that will become available in 2026. Then we have 7 regulatory specialists too, who actually process the applications amongst the 3 professions. So we have some people processing social work, some processing mental health, and some processing marriage and family therapy. Again, Candace is the primary person processing marriage and family therapy at this time. And then we have 1 board counsel, Timothy Frizzell, who is actually employed by the Attorney General's office, and he represents the board, not the Department of Health, but the board. So when you attend our board meetings, you will see where he provides advice to the board. He help to write the rules for the board and help to advise them when they're making their legal decisions. So our new annual report has just been published, and it is available to you. Annalyn, I will share this PowerPoint with you so that you can share that link as well. And if you're interested in having some of these statistics, it is available to you on our website. Right on the home page, you will find a link to the 2024-2025 annual report. And again, I wanted to just provide these numbers so you can see that in our office, we are regulating over 56,000 licensees. That doesn't attest to the number of applications that we have received. But you can find that information in the report. How many applications we received throughout the year, how many licenses were issued throughout the year. So as you can see, marriage and family therapists make up about 3,713 of those licensees. Those that are provisionally licensed make up about 51. And then those who have the registered marriage and family therapy intern registration is made up of 832 people. Okay.
Yeah, so I noticed you did not include the telemental health people, and that's another big number.
It is. And so what Annalyn is referring to is the out-of-state telehealth registration. So Florida allows those who have a license out of state that is comparable to that of Florida to hold an out-of-state telehealth provider registration. And so they can provide telehealth services to the citizens of Florida as long as they are registered with the state. So you are right, Annalyn, that is an even larger number to consider. So I want to talk a little bit about applying for a license. I do know that we have one student on the call tonight, and so hopefully this is able to reach a few more students as we go through this information. And of course, feel free to jump in at any time to ask any questions that you might have. And Lynn is also going to help me monitor the chat and ask questions. So if you don't want to raise your hand and just audibly ask the question, feel free to drop it in the chat. So the quickest way to find our licensure information is our webpage. That webpage is Florida's mentalhealthprofessions.gov. Once you get to our webpage, if you want to find licensure information, you will just need to click on the upper right-hand corner under, upper left-hand corner under licensing and renewals. You will also find that the information is on other parts of the web page. So even if you want to click on apply for a license, it's going to take you directly to the application. But if you want to get information about the licensure and applying for the license, just click on licensing and renewals, and all of the information is listed there. So one question that we receive quite often is, how do I know what license to apply for? So if you are someone who has not completed your postmaster's experience and you intend to practice in Florida, you must register as an intern prior to commencing the experience. If you are someone who has completed your 2 years of postmaster's experience, you should submit the application for a full licensure. So those are the two differences. The main purpose of the intern registration is to earn the 2 years of postmaster's experience. Once you click on apply for a license, it will take you to the MQA online services page where you can register for your online account, which will follow you throughout the duration of your time as a licensee here in Florida. You create your application here. You'll be able to track the progress of your application on this website. And once the license is issued, you can even go here to update your information, whether that's an address change or a name change. You can do all of that here in MQA Online Services.
And I'd like to point out to people that it is in the law that you need to change like an address within 30 days, or that's actually a violation.
That's absolutely right. It is very important to keep the department up to date with the changes about your license. So if you have moved, because our main form of communication with you will be either through your mailing address or either your email. So it's very important that we have those two pieces of information available. So I have broken this down into a 3-step application process. And so step 1 is to prepare your supporting documents before you apply for a license. The supporting documents that we will be looking for is, first, your official transcript, second, your clinical practicum letter, third, the qualified supervisor letter, and lastly, your background screening results. So once you have collected all that information, you are ready to apply for a license. Again, the fastest way to apply for a license is online. You want to visit our website, Florida's mentalhealthprofessions.gov, select registered marriage and family therapy intern, and apply online. Applications will not be processed until we receive the full payment, and the cost for an intern registration application is $150. It is a non-refundable fee, so it's very important that you know which application to submit, because even the full licensure application has some parts that are also non-refundable. Okay, so then the third step is to wait and receive a deficiency letter or an approval letter. So within 30 days, the application processing team will either send you an approval letter if you have provided all of the correct documentation and you meet all the qualifications. We will send you an approval letter. If you have some items that are missing, then we will send you a deficiency letter. So if there is any additional information needed along with your application, you will receive that deficiency letter. Most importantly, on the letter, in your online profile, you will find a file number, and that is how we track your information throughout the duration of the life of your application. So it's important that you write that file number down and keep track of it. Your file number will be different from your license number. It will not be the same, okay? So it's important that as a registered intern that you don't start practicing with that intern registration or the file number, excuse me, prior to being issued the intern registration number, okay? So these are just some tips for the application process. Allow up to 30 days for processing. By law, we have 30 days to respond to the initial application. Okay, allow 7 to 14 days for processing faxed, mailed, or uploaded documents. So if you need to submit an additional document to our office, allow us 7 to 14 days to process it. We process in the order in which we receive items. Incomplete applications expire after 1 year. And again, your file number will be different from your license number. This is very important. As you can imagine, we've seen some very tragic instances where individuals have believed that that file number is their license number, and they have begun to practice under the file number. It is not. After 2 years, they've had to come before the full board. Unfortunately, that experience that they have accrued has been denied because it was not completed properly, not under the statutorily mandated guidelines.
If I recall correctly, Ashleigh, an official registered intern number will start with IMT.
That's correct.
And but the file number is much long. It's really IMT and then maybe about 4 digits for us because we're not that many of us. But the file number is much longer, I think. It's got
That's
a
very
lot
true.
more digits. Yeah.
Okay, so when applying for a license, I just want to tell everyone what we're looking for when we are reviewing these documents. So the requirements for the official transcript. For marriage and family therapy, you must have a master's degree with a major emphasis in marriage and family therapy or closely related field from a program that is accredited by COAMT, CACREP, plus graduate coursework, or a degree conferred before September 1st, 2027 from an institutionally accredited college or university and graduate level courses. And we're going to go over that a little more in detail later. Official transcripts must reflect the degree conferred date. So please, if you are a student, don't order the transcript super early. Wait until the degree has been conferred before you send it over to the department. Transcripts must be sent directly from the university. I know sometimes students will obtain a copy for themselves, for their own records, and then send us the copy or try to upload a copy of their unofficial transcript, but that is unacceptable. We must receive this document directly from the university. And one way
actually,
to do that.
don't most universities have an electronic system, either
Yes.
parchment or something like that that will do that?
That's right. And that's exactly what I was getting into. That last bullet point, your university may have a parchment service that they can send that transcript through. And I recommend this for students because you can really track the progress of that transcript. You will know exactly when the school mails it to us. You will know when we open the document, and through your online portal, you'll find once it has been reviewed. Okay, so then after we receive the official transcript, we're going to look at the coursework requirement. So if you are a graduate of a COAMT program, no additional coursework or practicum letter is required. But if you are a graduate of CACREP or institutionally accredited program, there are a few more things that you need to have. Okay, so the coursework must be a minimum of 3 semester hours or 4 quarter hours of graduate level coursework in each of the 11 subject areas listed. And we'll see on the next slide that you can become licensed as a registered intern if you're missing one of the top 3 courses. So either the dynamics course, if you haven't taken that, if you haven't taken theories, of marriage and family therapy, or if you haven't taken any family therapy and counseling theories and techniques course, then you can be missing one of those and still become a registered intern. You must have all other courses prior to us issuing the registration. Okay, the third item that you need is the practicum letter. It must come from an official of the school, and that would include your dean, your department chair, so on and so forth. Some schools have specified staff that completes this form for their university, but we need to know how many hours you have completed in your practicum or internship. Marriage and family therapy is very specific in how many are required, as I believe the total requirement is 400 and 200 relational hours, 200 or 300 relational hours are required. So it's very important that that is specified on the letter when it comes to our office.
And again, this is for people who are either don't have a program accreditation or KCREP. If you come from COAMFT, that's Capella, FSU, Florida State or Nova Southeastern. Those are all and National. Those are all COAMFT programs. They do not have to have that that letter
And
because
you
of
can
their
always
COAMFT.
check on those accrediting bodies' websites to see if your school is accredited accredited by that body.
Right, right.
Okay, so the last document we'll need is the qualified supervisor letter. And this is just a letter stating that the qualified supervisor has agreed to provide supervision to you while you are a registered intern. It's very important that I state this. We're going to talk a little bit about the minimum requirements for postmaster's experience. But many people know that it's 2 years of experience and 1,500 hours of face-to-face psychotherapy. Some people believe that once they have completed that minimum requirement, that they are no longer required to remain under supervision. The statute actually requires you to remain under supervision until you are fully licensed as an LMFT. So it's very important that you continue to remain under supervision even after you have met the minimum requirement. Okay, so we already talked a little bit about this note. You can become a registered intern having met 10 of the course content areas. As you saw on the previous screen, there are 11. 6 semester hours must be in those family systems, theories, and techniques courses. So that's what I was saying earlier. You can only miss one of the top 3. Okay, if you don't meet the practicum requirement, the hours may be obtained as a registered intern and must be documented on the Marriage and Family Therapy Graduate Practicum Attestation Form by your board-approved qualified supervisor. And you can find that form on our webpage under the Resources tab. And if you can't find it, if you have a problem navigating, you can feel free to give us a call. We'll help you find that document. Any remaining courses and practicum hours must be met prior to obtaining your exam approval. So this is very important, and I know Candace is probably screaming behind that screen. But yes, all of your coursework and your practicum hours have to be complete prior to us issuing the exam approval to you. Okay. Do we have any questions in the chat, Annalyn?
No, we do not, but I do
All right.
want to emphasize that that you want to have all if you're COAMFT, you again will meet all the education requirements, which means you'll be allowed to take the exam right away. And we always encourage you to do it right away.
Yeah. Okay, and this is just a sample of a practicum letter that's been made into a template, and it's very simple. Just includes the name of the applicant, their file number or their social security number. Some schools put the social security number instead of the file number. Be careful with that. Our preference is the file number, okay, just to protect your social. We also want to know when the degree was awarded, the conferred date, and the total number of hours that you completed during your practicum. Again, we definitely needed to be broken down into those relational hours and the total number of hours that you have completed as well. All right. I want to talk a little bit about the 2 years of postmaster's experience. So experience is defined in the board rule as 2 years of clinical experience, consisting of 1,500 hours of providing psychotherapy face-to-face with clients, accrued in no less than 100 weeks. So when you receive the verification of clinical experience form, you will see that we have broken that down on that form, exactly how it is written in the rule. So I'm going to just go ahead and skip ahead. This is the form, and this is what I like to call the meat and potatoes of your application for full licensure, because it really has all of the information about the 2 years of experience that you have completed. And it's very important that you make sure your qualified supervisor fills this out in its entirety. And so a few things I want to point out: not only do they need to put your name and your Florida registration number, they need to select your profession, because again, this is a composite board. It has multiple professions. So they're all using the same form. So make sure they're checking your profession, actually entering their name on the form, also their email address in case we need to contact them. We want to know their license number, what state they hold a license in, and the license type. And this is where we have included the board rule for your knowledge, so you know. Okay, so the very first date on this verification form is the start date of the supervision. It's very important that you do not put any date prior to your approval from the board here. Okay, we want to see the date that we approved you to start supervision with this person, not the few weeks that you went prior to and you guys talked and you had your introductory meeting. We want to know the approval date and when did you actually start having supervision. Also, the end date is very important. Please provide a specific date in this line. Do not put up until present, will continue to supervise. Actually put an end date. Something else that we're looking at when we're reviewing this form is to make sure that that end date is not after the date the document is signed. So don't put a date that is in the future. These hours should be complete prior to you submitting the form. Okay. So if we have any issues with this, we will send the document back to be corrected. And so this is what takes a really long time for most of the applicants in this profession, is that these forms are not filled out correctly. So again, just follow the directions that are here. Enter a hard start date and an end date, knowing that the start date is the date that the board office approved you. It cannot be prior to that. Also, the line B is about the time or the number of hours that you have received supervision with your qualified supervisor. So we want to know the total number of hours in this second line. The third line is about the total amount of hours that you have provided face-to-face psychotherapy with clients. So we need to see something close, all of the hours that you have provided psychotherapy online. Okay, does anybody have any questions about that form at all? Any parts so far?
I do have one question to clarify. For marriage
Mhm.
and family, the rule also says that 50% of their hours has to be relational.
That's
And
right.
so that's not on this form, that
No.
information, but it does say that that they have met everything related to it's implied by saying that we understand and they have met everything having to do with that rule. So
Mhm.
it means that for MFTs, even though it doesn't ask for the 750 or the 50%, you still have to do it. And there were a lot of people that contacted me wanting to say, it doesn't say it on the form, so I don't have to
Right.
do it, right? No, it
Okay.
still says it in the rule.
That's right. And maybe that's something the board can consider in the future. Maybe a section that says for marriage and family therapists only, 50% of your time relational.
That would certainly clarify it, and it used to say that, but that is
Mhm.
what I preach is,
Okay.
because it says I've read and understand the rule, it is in the rule. It's implied.
Mhm. That's right. Okay, so the last parts of this form, which also just as equally as important, is your qualified supervisor needs to tell us if they intend to continue to provide supervision with you or if they will no longer be providing supervision. And if they will no longer be providing supervision, we need to know the end date in this line here. So qualified supervisors are only allowed to have 25 interns at a time. That is the maximum for any qualified supervisor. And so we are also verifying that this supervisor doesn't have any more interns than they should. So it's very important that if they are no longer seeing the person, that they put the close out date here so that we can remove the intern from the license of the qualified supervisor.
Right,
And
but that means if you as an intern don't have your license in hand, you need to find another supervisor to make sure that you're still under supervision.
That's right. That's right. Even if you have completed the 1,500 hours in 2 years, you need to remain under supervision until you are fully licensed. And as Annalyn spoke about earlier, there is a supervisor statement here where you attest that the intern has met the minimum standards of performance in the profession, and there's a yes or no box. The supervisor needs to sign the form. It is important that they actually put a signature here. Don't type anything in this line like a word font or something of that sort. Now, we can accept electronic signatures, but not a typed font, okay? And also important that you put the closeout date, okay? Provisional licenses are available only to applicants for licensure by exam or endorsement who have already met the minimum requirements of 2 years of postmaster's experience, but they do not meet Florida's licensure requirements. It allows someone to practice under supervision while they meet any additional licensure requirements, such as additional coursework, the exam, or continuing education. Now, this was a hot topic a while ago with the 5-year limitation for interns. There were a number of people who were registered interns. They had the registration for longer than 5 years and could no longer have the registration. The registration expired, and now they were no longer able to practice. So many people started to inquire about the provisional license. And so these are the minimum requirements for the license. You must have completed the 2 years of postmaster's experience in order to qualify for this license. And as stated before, you also must submit an application for licensure by exam or endorsement. You cannot start with the provisional license. You have to first submit the application for either exam or endorsement. And if you don't meet those qualifications and you've met the 2 years of postmaster's experience, then we can offer you a provisional license. This license is valid for 24 months or 2 years, and it cannot be renewed or reissued. So you can only have it one time. Okay. If you apply for a provisional license, you can no longer apply for an intern registration. That is also a part of the law that changed back in 2016. So I put that information in the chat about the law that changed that 5-year rule and provided the 5-year limitation. Okay, so exam information. To become a licensed marriage and family therapist, you will need to pass the national exam developed by AMFTRB and Professional Examination Services. An applicant who has completed all education requirements will be admitted to the exam for licensure. Applicants must request exam approval prior to contacting their test provider. And the way that you gain that approval is by emailing our office. And again, Candace will be waiting for you to issue the approval. The registration for the exam can be found at the link that has been provided. So once you qualify for the exam, we will send you a secure code and the link to register directly on their website.
Now, Ashley, I get the impression that that code actually like expires. So like if someone gets registered in January of 24 and they delay taking the exam, by the time, end of 25 when they've almost got their 2 years done, that code could expire. So they may
Right.
have to ask for another one.
That is very true. That has happened to us before. Most exam vendors will expire the approval within 1 year. So you definitely want to
1
take it
year. Okay.
prior to that. And if Candace, if it's even shorter than that, just let me know. Okay. So, like to become fully licensed, these are the requirements. To be licensed as a marriage and family therapist in Florida, you must meet all of the education requirements that we've gone over previously. So that's all of the coursework and the practicum hours. You must have the 2 years of clinical experience. You have to have passed the exam. And then there's continuing education coursework that you must complete. There's an 8-hour laws and rules course, as well as a 3-hour HIV and AIDS course. The board rule does also require you to complete a domestic violence course, but this does not have to be submitted when you first submit your application for licensure. The domestic violence course can be completed up to 6 months following licensure, and there is an attestation form in the application that states that you will complete it. Now, if you were coming from out of state and you were previously licensed, and let's say, for example, you have not been licensed for 2 years to meet the endorsement requirements, you may need to provide us with a license verification from your state. We want to know when you were issued a license, the license type, did you have any disciplinary actions against your license, and we also need to see the expiration date of your license. Okay. Continuing education requirements are listed here. Again, it's the 8-hour laws and rules and 3-hour HIV/AIDS course, which is required in the 491 Practice Act, as well as 6 months for the 2-hour domestic violence course. You can find all of these courses through a free course search on cebroker.com. I believe my next slide is about CE Broker. There we go. So CE Broker is the official continuing education tracking system for the Florida Department of Health, amongst other organizations. And so what happens is all of our courses are housed on this website. So if you are ready to take a course, then you will go here to search that course. If you have gone to a conference or you've taken a course through your job and you want to add it to your transcript, this is where you will come as well to add that information to your transcript. You do not have to purchase the packages that CE Broker offers. There is a free account that's offered to everyone. But if you want your account to do a little bit more, if you want them to notify you when certain courses are required, then they do have other packages that are available for purchase. So once you receive the license, you must maintain it. And so I'm going to talk a little bit about renewing a license. You must renew your license every 2 years, or you will hear us use the term biennium. You will pay a $120 active to active fee and complete 30 hours of continuing education coursework. This information, again, is available on our website under the renewals tab at floridasmentalhealthprofessions.gov. As you can see, the courses have been broken out into the required courses. So let's say 30 are required. Each person is required to take 25 general hours. That's hours in any subject area that you want to take, a minimum of 25. And then 2 hours are required in medical areas. That is required across the board for all 22 healthcare professions. And then we get into the nuances here. Everyone is required to take an ethics and boundaries course or a course on telehealth in alternating biennial renewal periods. So you will alternate these 2 courses as you renew. The laws and rules course is required every 3rd biennium or every 6 years, and that is to be included in the 25 general hours, okay? You will see this is different from the 8-hour course that is required for initial licensing. I like to think of this as like a refresher course for those who are already licensed. Domestic violence is required every 3rd biennium, and it's also included in the 25 general hours. And then if you are a qualified supervisor, this is fairly new. Board incorporated this a few years ago. These hours are required every third biennium for qualified supervisors only and are included in the 25 general hours. So again, this is almost like a refresher course. It is different from the initial course that you've taken to become a qualified supervisor. This is just to make sure you're up to date on all the newest laws and rules for the profession. You also see on the left side the fees for renewing the license. So I know there's a lot of numbers, but I'm going to try to break it down for you. Okay, so if you're renewing before your expiration date, and this profession renews on March 31st of every odd year. So the next time that they will renew will be March 31st, 2027. And that's also when the background screening will be required for the first time. If you're renewing timely and going from active status to active status, then your fee will be $120. Okay, so if you are going from inactive status to inactive status, that will only be a $55 fee. If you're going from an active status and you now want to change your status to inactive, you will pay a $55 fee, and you don't have to complete these CE courses. Okay, if you're going from inactive to active, then that will be $170 fee. If you are going from active to retire, it will be a $55 fee. And again, you don't have to complete those CE courses. And if you're going from inactive to retired, then that will also be a $55 fee. And as you can see on this chart, if you wait until closer to the expiration date, the fee increases. Okay, so if you are renewing after the deadline, you will see how much the fee increases, almost $105 here just for active and active. So that's anyone wanting to renew, let's say on April 1st of 2027. Okay, and then that's where your fee will change here. Okay. And then if you are what we call 120-day notified delinquent, okay, all renewals open up about 90 to 120 days prior to the expiration date. If you have missed 2 bienniums or 2 renewal periods, then we will send you a notification. This notification means you are about to lose your license. And we are informing you that you will lose this license if you do not complete the required coursework and pay the fee. So it depends on what status you're changing to and how that fee is applied. I also mentioned that the first biennium renewal, there are no CE courses required. Okay, if it's your very first biennium renewal, you'll just go online and pay the fee, and you don't have to meet these requirements. But your next biennium, you will pay the fee and complete the continuing education coursework. Okay. So I want to talk a little bit about legislation impacting your profession, and House Bill 975 was the background screening requirements for healthcare practitioners. And as of July 1st, 2025, most healthcare practitioners must comply with background screening requirements when applying for initial licensing and renewing their license. Okay, so this is the very first time that your profession is having to do this at the initial application and also at renewal. So that means those of you who hold a license currently, this renewal period, you will be required to be background screened prior to that. We're going to watch a short video in a minute about the background screening so that you can see how simple it is. We have a wonderful Clear to Care campaign that is going on, and I'd like you to see that presentation. So again, failure to get your background screening completed on time will result in you not being allowed to renew your license. Background screening process takes some time due to multiple required steps and processing. So waiting too long will result in licensing delays or expirations. You don't want to wait until 2 or 3 weeks before the expiration of your license to go and get background screened for the first time. Okay, so
Ashleigh, is it possible to screen too early? Like it's
no.
25 and we don't renew it. Those of us who are licensed don't renew until March 27. Can I do it now for my March 27 or is it too
You
early?
absolutely can do it now. What it affects is your retention schedule. So after you are background screened, you are required to retain your prints for 5 years. So it is going to affect your expiration date of the prints. Okay, so it's up to you when you decide to go. As a matter of fact,
So does that mean though that, so if I get it, let's say I get it the end of 26 for March of
mhm,
27, I don't have to do it again for 5 years, or I will have to do it for 2 years later for 29?
you will only be retaining your prints. If you do not retain the prints, and when I say retain, that means you have to pay a $42 fee to FDLE to maintain the prints that you have already taken, right? So if you miss the expiration of that and you do not retain those prints with them, then you will have to go into another live scan provider and get those prints completed again.
And
Okay.
but they can only be retained for 5 years. After 5 years,
Right, that is the schedule.
they'd
So
have to
that
have
is
new ones.
That's right. So it's kind of like think about it almost like the expiration date for your license. So the expiration date is going to be in 5 years. You have to retain those prints. What we're working on is being able to actually incorporate that into your renewal fee. So maybe by the time the mental health professions come along, that will be incorporated in the renewal. So we'll see in
Do you think by
2027.
27? Really? As early as 27? Okay.
Yeah, yeah. So actually, I'm going to go ahead and cut this presentation off for here. I want to provide you with my contact information for anybody that needs to contact me. And I'm going to start this webinar just so you can get a little more information about background screening. This information is available on our website under the background screening tab. You can go online and have access to this webinar. So give me just 1 second. I'm gonna pull it up and share my screen with you.
Yeah. Yes. And so Lynn wanted to know, do registered interns applicants need to do a background for their registration? I believe the answer is yes. So anyone who is not currently registered or currently a provisional license must do the background screen in order to get that.
That's right. So that's a part of that 3-step process that we talked about in the beginning. When you are preparing to apply for a license, you want to make sure that you have prepared not only your official transcript, your practicum letter, your qualified supervisor letter, and prepared to go and get background screened. Your application will be held up if you do not get screened. Okay. All right, you guys can see my Clear to Care presentation here.
Yes.
All right. Can you hear it? Medical quality assurance.
Yes. It's a little broken. Not hearing it now.
I can't hear anything.
Okay.
Yeah, not hearing it now. If there's a link, I can make it that you can pop into the chat, then I'll make sure that that link goes out with the PowerPoint that you're going to give me when I send this recording. So there's the link. Very good. So everybody grab that so that that you can watch it.
That's right. Okay, let me try one more thing. All right. Can you see this screen?
Nope, I see all of us. I don't see you sharing at this time.
Okay.
Now I see you starting to share your screen. Yep, we have your PowerPoint on background screening. Yep.
Okay, there we go. So just briefly, I'll go over some of the FAQs that we receive on background screening.
Great.
I'm so grateful to our strategic marketing manager who couldn't be here tonight, but she did share her presentation with me. This is Amber Tooks, our marketing manager. But again, this is about the House Bill 975 background screening. and certifications that was passed during the 2024 legislative session that established background screening requirements for healthcare professionals regulated under the Department of Health. And so this is brand new again. As of July 1st of 2025, all applicants must submit electronic fingerprints before a license is issued or renewed. So how does it work? Act now, don't delay. Know your timeline. The background screening process takes some time. So again, due to multiple steps and processing delays, waiting too long can result in licensing delays. No background screening equals no license. You cannot obtain your license without completing the requirements. So start the process early to avoid disruptions. So steps to initiate and track screenings. First, getting cleared to care is a straightforward process. And here are some of the key steps to ensure that you have a smooth journey. So first, you want to create your profile in the CHI system, and CHI stands for Clearinghouse Applicant Initiated System. And you can find the link on our webpage for that system. This is where your prints are stored and managed. Next, schedule an appointment with a live scan provider. Visit a local provider. You can locate a provider by visiting our background screening webpage and clicking on the Locate a Provider tab. And I will tell you, this is a national tab. It is not limited to Florida. So if you are moving to Florida, if you haven't found a provider yet, you can use this tab to locate a local live scan provider. Bring your ORI number to your fingerprint appointment. This links your screening to your profession. Always request your TCN number from the live scan provider. I like to think of that TCN as an address. So it tells them where to send those prints, and you can track those prints in the system. Track the submission of your prints by entering your TCN number at the Florida Department of Law Enforcement TCN lookup. I've already heard great things about this, how quickly this system moves and how accurate it is as far as receiving the prints. Okay, I definitely don't want to skip this page. You must complete the privacy statement. So in the application, whether that be initial or renewal, you will find a privacy statement when you are applying for a license. You must agree to the privacy statement regarding the electronic fingerprinting within the application. If the privacy statement is not received, your fingerprints cannot be shared with the Department of Health. So this will delay your application for initial licensure or renewal. Your fingerprints must be retained every 5 years. We'll send reminders, but it's your responsibility to ensure that they are active. So check your MQA Online Services account regularly.
So, oh yeah, sorry, you were going to finish.
No, that's it. Okay, almost done with this presentation. So the importance of retaining the fingerprints every 5 years, like you asked. If your fingerprints expire before your next licensure renewal, you will need to complete a new fingerprint-based background screening in order to renew your license. The department provides email and mail reminders for upcoming fingerprint expirations. So keep your contact information up to date in your MQA Online Services account. For those with an existing screening in the clearinghouse, maybe you've had to do this for your job, or maybe you volunteered at your kid's school, you must retain your prints to remain in the system. And the cost of retaining the prints is significantly less than the cost of a new screening. So again, I think I mentioned earlier, the retention is about $42. Sometimes a new screening can be about $175.
Ouch.
Yeah. If you are unsure if your last screening meets the requirements, contact the background screening unit at mqa.backgroundscreening@flhealth.gov or use the virtual assistant Eli. If your screening from a DOH ORI hasn't loaded into our database, and the clearinghouse status says no, email fingerprint retention at flhealth.gov. The processing time for results to load is 48 to 72 hours. So for more details on the renewal process, visit the Florida Board section of the flhealthsource.gov or use the virtual agent Eli. So here's just a few FAQs. What is a retained print and who must retain their print? So retained prints are the fingerprints stored by FDLE that are submitted by a live scan provider for background screening. The retained prints are maintained for 5 years. If you are a doctor or in one of the professions that were previously required to be fingerprinted, you do not have to do it again. But for those who have never done this before, then they will be required to put their information into the database. Okay, the third FAQ is, can the department extend the expiration date? And this is referring to the expiration of the prints. The answer to that is no. The department cannot extend your retention window because of the confidential and sensitive nature of the information. The protocol is set by the Federal Bureau of Investigation, or the FBI, and has to be adhered to by the Florida Department of Law Enforcement. Number 4, fingerprints don't change. So why do I have to retain or complete a new screening? Retaining your prints runs new national and state background checks so that the results stored in the clearinghouse are current and valid. If fingerprints are not retained, the data is purged and a new screening must be completed. Again, I'm very grateful to our marketing manager, Amber Tooks, for sharing her presentation with me today. And so if you guys have any questions at this time about background screening or the licensure process, please feel free to ask at this time.
So Ashleigh, the two things I did not understand was the ORI number and the TCN number. Where you said that when I go to the live scan provider, I need to give them the ORI number. I'm sorry, what is that?
So the ORI number, it stands for like originating identifier or something like that. And so it tells the live scan provider where to send the print. So that's the number I was saying. It's kind of like an address. It tells them where to send the print. So you want to go in and take that information to your live scan provider. After you are printed, they will give you a very long number that is referred to as a TCN number. And then you will take that number, I think it's like 14 digits or something like that. And then you can put it in the web page where you can track your prints. And you will know exactly when the Department of Health has received the print.
It's like my UPS tracking number of my package.
Yeah.
Gotcha.
And we all love seeing those tracking numbers.
But I'm still not clear, where do I go on the website to obtain the ORI number?
That's right.
Okay.
So maybe since we're online, maybe I could do something.
So I would go into the board website or the MQA website to get that.
It's in multiple places. So if you can see my screen, I'm on the board's website.
I see it. Yeah.
And then we're going to click on background screening.
Okay.
And so this is the page that you saw earlier. We're just going to see if it's on this page. It's on. This is where I was telling you that you can find a provider anywhere, right? Anywhere in the United States. So any part of Florida, if you are international or if you just happen to be out of state, you can find that information here. Okay. These, so what you are asking about is under the screening requirements tab. Okay. And so here it provides information. Again, we've gone over all of this about the 90-day window, when it all opens, how much the fingerprint retention costs, so on and so forth. But here is the ORI number that I was referring to,
I
and it
see it.
stands
So
for
ours,
Originating Agency Identifier. So you
got
want to go
it.
down to your professions, which will be clinical social work, marriage and family therapy, mental health counseling. Your ORI number is EDOH 4550Z. And so that is what you will take into the live scan provider. And that they will use that kind of like an address, and they will know exactly how to identify the agency that this information is going to. Then you will receive that long TCN number, and then you can put it in the department's webpage and you can track your prints.
Got it. So thank you. That it's now making sense. I appreciate
Okay.
that. We do
Okay.
have a quick question. Someone said your job recently did background checks.
Mhm.
Can that information be used, or should she do it again through this system?
It just depends. You need to log into that system to see if those prints have been sent to the Department of Health.
So they'd have to go into the tracking system to see if it was sent to Department of Health, and if
That's
it
right.
wasn't, is there a way to get it sent to the Department of Health?
I'm not sure of that process. I would
Okay.
imagine that
Okay.
you would need to go in and get new prints at that point.
Gotcha. Gotcha. All right. All right. And
I
then
also dropped
these,
the link, excuse me, I'm sorry. I
yeah,
dropped the link to the background screening page in the chat as well for anyone who needs that information.
that's great. That's great.
I
Yeah,
have a
this
quick
is
question on the
wonderful.
topic.
Yes. Mm-hmm.
Hi, thank you so much. This information is very helpful. Just regarding the background check, this was put into place. What is it filtering? I guess what would be any, background outcomes that would affect licensure?
Maybe like disqualifiers, right, from
Mhm.
licensure. Right, so we actually have some of that information on our webpage under the licensing tab. If you click on your profession, you will find under the process tab where we identify what we call a criminal history matrix. So something like a misdemeanor, something as small as like a DUI, driving with a suspended license, those things will not disqualify you for licensure, but there are certain felony charges that will disqualify you for licensure, and those fall under, I believe, 456.0635, and those are what we call deemers, and you are automatically prevented from being issued a license for certain felony charges, especially if they relate to Medicaid, Medicare fraud. If you're listed on the OIG's list, the exclusion list, you will not be able to apply for a license. But there are some exceptions. So let's say you had, or someone, an applicant had 7 DUIs. That may not disqualify them from licensure, but they will certainly need to go before the board because there's obviously a pattern there. And so the board would need to determine the safety of that applicant, because again, their main job is to protect the safety and the welfare of the public. So if someone received 7 DUIs in the last 2 years, then they may want to consider how they issue the license, or if they will issue that license to someone. Perhaps they need additional monitoring or some additional supervision.
Super helpful. I will definitely look through the website to learn more about it. Thank you.
Okay, you're welcome.
Yeah, I almost think MFT programs should ask all of their people to go get a background screen and just see, is there anything there if they have the least bit of concern. So
Yeah.
yeah, this is good to know.
Yeah.
Yeah. I've been licensed for a very, very long time in this state. This is the first time we've had background checks.
I
So
thought this
this
was,
is
I thought
so
this,
new.
I didn't know that. I was under the impression that it was a part of it.
It's brand new as of July of this year.
That's right.
Even the staff are like, this is really new.
Yeah.
Yeah.
I don't know why I thought it was a part of it, just because with different institutions, like you have to do it to
Sure.
work there, I assume,
Sure.
to hold that
Yeah,
staff.
like public schools, things like
Yeah.
that. Yep. Yep.
Mhm.
That's very true. That's
Even
very
treatment
true.
centers with children and adolescents.
Yes.
Or
Yes.
mental health
Anything
now.
with kids. Sure.
Yeah.
Sure. Sure. Ashley, have there been any changes to the law, other changes to the law, or upcoming changes or questions of the law that would be good for us to go over? The one, of course, that immediately jumps to mind is allowing virtual supervision to continue past, I think, the June of 2026. I know that's going to go before the board sometime in March.
Mhm.
Um, so I know that's upcoming. Is there anything else? I think the 5-year limit for MFT, that don't have accreditation, that comes up in 27, I
Mhm.
think. So could you
Yes,
speak to
that
any
is
of
true.
those upcoming things?
Sure. So I think I'm still sharing my screen, and
You
on the
are?
home page of our website, the very bottom, we have our latest news tabs, and you can always find out information about new bills or legislation that's impacting your profession. So I'm going to click right here and just highlight a few that that's impacted your profession in particular. So let's see. House Bill 1299 was the Department of Health bill. It took effect on July 1st of 2025. And the bill revised several laws, but the one I want to point out to you is about the Mobile Act, which is the endorsement pathway into licensure. So the Mobile Act was adopted in the 2024 legislative session. And in this 25 session, they amended some of the requirements. So here they revised the active practice requirement for licensure by endorsement under the Mobile Act from 3 years to 2 years. So if you are
Okay.
out of state practitioner and you've held a license for at least 2 years, you can come in through the endorsement pathway, and you don't have to provide all the forms and all that information. You just have to pass that national exam and have 2 years of experience. There are some disqualifiers like any previous discipline, but again, this is one of the amendments to the Mobile Act, is that anything that has been reported to the National Practitioner Data Bank that does not disqualify an applicant from licensure, if the reported conduct would not constitute a violation of Florida law. So if it's not a violation of Florida law, we will not prohibit you from applying through this pathway. Your data bank hit can go before the board, and the board has discretion, regarding the adverse action that has been reported to the National Practitioner Data Bank. This is great news for individuals, let's say, for example, who have been disciplined in other states for continuing education, or other various offenses that are not a violation of Florida law, because it will allow them a pathway into Florida to become licensed. So that's one major change that I can highlight here. The board just recently did rulemaking on the overpayments made by patients. So the legislator has mandated that in January 1st of 2026, that healthcare practitioners who accept payments from insurance for services rendered by healthcare practitioners to refund an overpayment made by a patient no later than 30 days after determining that the patient made an overpayment. So essentially, the practitioner has 30 days to provide that. If they do not, then it can be considered a violation, and they can be disciplined for that action. So please come visit our webpage where we have updates on legislation that has affected the board. You can always find information about the board meetings and rules that we have discussed, or excuse me, the board has discussed, just by going to the board meeting tab, click on show past board meetings. Let's say, for example, you want to see the information that was discussed in August. You will go to the meeting minutes. We also have the meeting audio, always provide the agenda and the notice of the meeting. And you can scroll through and read about any of the updates from the board. And we also always timestamp those minutes. And I probably need to say thank you to Madeline for that, because she always keeps those minutes for us. So, Annalyn, did I touch on all of the issues that you asked about? I think the last one was about marriage and family therapy and the September 1st, 2027 deadline. So I'm gonna go back on the webpage under licensed and marriage and family therapist, and we have highlighted under the requirements just what Annalyn is discussing. So there was a legislative change in 2020 and again in 2022 to revise those changes, but the effective date is September 1st of 27. And so earlier we mentioned that you must have a master's degree from a program that has a major emphasis in marriage and family therapy or a closely related field, and those accrediting bodies have to be COAMT or CACREP. Now, the third provision to that is that you can hold a degree that has been conferred before September 1st of 2027 from an institutionally accredited college and university. So if you are in a program or you graduated from a program that's not COAMT or CACREP accredited, it will be very important for you to submit your application prior to September 1st of 2027, because at that time you will be prohibited from qualifying for licensure.
Now, so if someone got a degree in like another state that that was not accredited, and they held that license and got licensed in that state, you know, the state of boredom, and they went to the University of Boredom and got their degree that was not accredited, and they held that license for 2 years, then they could apply for endorsement under our
That's
endorsement laws.
That's
Right.
absolutely true.
Yeah, so that's the way to go around it if someone's gone to a non-accredited program. But it means staying in their state, getting licensed in that state, all that kind of stuff.
Right. And if you want to know more information about the mobile endorsement pathway, that is also available on our website on the licensing tab, or you can click one of our quick links over to the left.
That's great. Okay. So supervision by virtual supervision is still the rule at this time. The board will take that up sometime in the spring of next year, and we'll see then if there's any change to it at this point. But as of right now, it's still by rule allowed to be virtual.
Yes.
Very good.
So yeah, it is. I'm gonna just show you real quick how to find it. So you go to the resources tab, we have our laws and rules listed. Sorry, I'm gonna have to close this. What I can see. All right.
Yep.
Under chapter 6.4B4, you want to click on 2.002. We're going to click on the entire rule. Can you see the rule on my screen?
Yes, yes, it just popped up.
All right. So here, under the definition of supervision, I believe Annalyn is referring to
number 7. Yes.
Number 7. Understanding subsections 3 and 4, and please in your free time take time to read it in its entirety. A qualified supervisor may utilize face-to-face electronic methods, including telephone-only communications, to conduct all supervisory sessions for internship hours if the qualified supervisor determines through their professional judgment that such methods are not detrimental to the registered intern's clients and are necessary to protect the health, safety, and welfare of the qualified supervisor, the registered intern, or both. Any clinical hours obtained via face-to-face psychotherapy by electronic means shall be considered clinical hours for the purpose of meeting internship requirements.
Right. And so that means supervision can be virtual and clinical work can be virtual.
Right.
by
And
that
so
rule.
Anna Lynn was referring to the sunset provision that was added to the rule in parentheses 8, where the board will need to revisit the rule 90 days prior to June 30th of 2026.
Right.
Okay.
Appreciate that. That's
Mhm.
that is an opportunity for us to engage in some advocacy work when that comes around. When
That's
that
right.
time comes around. Exactly.
And
All
you
right,
don't
very
have to wait
good.
until then. If you have an opinion about it, you can certainly write to the board. Now you can attend one of the board meetings and make public comment about it. There was also the board will be revisiting some of their rules in the upcoming year. Over the next 5 years, they will be reviewing all of their rules.
Right. I noticed that on the agenda that it always shows which rules are being reviewed. Yeah,
Mhm.
exactly. Okay, very good. Well, Miss Irving, I can't thank you enough. This has been fantastic. And I noticed that there was even more information in your PowerPoint that we didn't even get to. So I
Yes.
look forward to passing that on to our members and to students. This has been fantastic. I thank you so much for your time this evening. And I will certainly encourage all of students and anyone who's applying for any level registered intern, provisional or full licensure, to look at this material and to reach out to you and your staff after they have carefully read the website. Look at the website first and see if they can't learn everything there first, but that you're available to answer questions. So
That's
thank
right.
you so much for your time this evening.
You're welcome, and thank you for having us this evening.